Suzanne is a native of Maryland, right next door, and has a truly remarkable story of perseverance and determination to share. Thank you, Suzanne, for sharing your story with us.
Thank you. Well, a lot of you guys have heard my story many times, so it doesn't need mine doesn't be long, but also it doesn't need to be too long. I'll start with my family history. There's cancer in my family. With my mom, she passed away when I was 8. My sister was 6, and my brother was 3. Um, it was a GI adenocarcinoma. And, I remember her time in the hospital. She was in the hospital most of the time at that point when you got chemo. We didn't know we couldn't give people the drugs the pre-drugs that we have now, where you could live a normal life for most of those years. And father was diagnosed with a lymphoma, and he didn't tell us right away. We were little kids, but my father, then later in life, was also diagnosed with melanoma, and then passed away from a brain tumor, which we don't even know where that brain tumor came from. My mother was the youngest of 9, and there was a lot of cancer in her family. So I just assumed I was going to get cancer at some point. I got colonoscopies at a young age. I did my breast exams at a young age. I had my moles checked, my OBGYN. I had genetic testing in the, I think 2000, exactly 2000 was my first time getting genetic testing. And nothing really ever came up. This is a picture of my daughters and I. This is the summer that I was diagnosed, and we were in Disney. And it was kind of a joke because we were walking around Epcot Center, and you're supposed to eat through Epcot Center. And every little whatever I got in Epcot Center, I ate. My older daughter Sabrina and I were, looking on the map for the next bathroom because I was either going to have diarrhea or throw up with each, and it was almost a joke to us. I don't know what we were thinking. Anyway, I did have a colonoscopy scheduled. I had talked to my doctors. They had said, of course, like all of us, it's reflux. Luckily, when I had my colonoscopy scheduled, I was 50, but I had already been doing colonoscopies. I think it was my 4th colonoscopy. They said, you know what, let's do an endoscopy because you shouldn't be throwing up when you eat. And you shouldn't have that much pain when, it was also at that point getting very painful to eat. So sure enough, there was a tumor at the fundus of my stomach, the top kind of curvature of the stomach. My mother was with me. It was still kind of a COVID-y time, but she was there. They did let her in. And, the GI doctor was shocked. He sent me right away for scans. I right away had an oncology appointment. That was September of 2021. So April of 2021, Opdivo had just been approved through Checkmate 623, and my doctor right away put me on Opdivo and Folfox. I had my port. Everything happened very quickly. I didn't understand what was going on. I was in shock. The scans showed metastasis all through my bones, which again, I didn't understand. To me, that sounded like better, oh, it's in my bones. That's not really going to kill me. But I didn't know how serious it was. And when I went for my first oncology appointment and I said, when's surgery? He said, we don't take out some cancer. You have cancer in your bones. You're not going to benefit from having your stomach removed. So I did ask him, well, what does this mean? He said stage 4. I said, well, am I going to live 5 months or 5 years? And he said, I don't know. So I was on Folfox and Opdivo, and I did very well. I had a endoscopy a couple months in. There was no cancer left in my stomach. My bones looked very sclerotic, less cancer in them, and I was doing well. Finally, the toxicity from the oxaliplatin kicked in, and my doctor said, okay, time for Cyramza and Taxol. And by then, I had, plugged in to the community. And I said, no, 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 we don't, that is not what we do. We drop the ox and we stay on the F in the Opdivo. And we were raising our voices with one another. He said, no, you get Cyramza and Taxol. And I had my stack of papers and I said, no, 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 no. And he did finally agree with me. And I went to, I called my doctor at Hopkins and I said, I'm right? I mean, this is what I've heard on our calls. She said, yeah, you drop the oxaliplatin and you stay on the 5-FU and Opdivo. So that's what I did. And I got a great year out of that. I felt pretty good. There was a lot of talk at that point about MSI. Do you have HER2, PD-L1, MSI? Well, I was PD-L1, so that's probably why I did so well. But I really wanted to know, do I have MSI? And I wanted the Signatera test. And he said, no, 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 you're doing great. You don't need the Signatera test. Finally, my doctor at Hopkins ordered the Signatera test, but it was a year in, and my cancer was too old, too diffused, and I couldn't get the test. And I've never been able, 2.5, almost 3 years in, I still can't get the Signatera, and it really annoys me. But anyway, so I did well. I had a good year, and I did go to Hopkins for a second opinion with a surgeon. And I think that was just the worst day of my life. And he said, no surgery for you. I said, well, how long am I going to live? He said, maybe 2 years, not 3. So next, do I do this with the green? So my next slide is, this is a very difficult time for me. I know that in the long run, this is a blessing, but I'm not there yet. It doesn't feel like a blessing yet. I was still arguing with my doctor about circulating tumor DNA, and I watched one of Hope for Stomach Cancer videos on blood biopsies. It was called blood biopsies. And I wanted to know about, more information for when my treatment stopped working. And Dr. Dean started at the beginning with genetics. And he said, CDH1, and I knew all about CDH1. I'd been to John Florin, I talked to Dr. Davis, and I knew all about it, and I didn't have it. And then he mentioned ctNNA1, and I was like, oh my gosh, that sounds very familiar to me. So I dug through and I found my genetic report, and sure enough, it was there, ctNNA1. And I called Karen Chelcom, who has since passed away, and she gave me Dr. Perry Guilford's information, and in New Zealand, and he said, this is pathogenic. And you have to get your whole family tested, your brother, your sister, and your daughters. And I always knew my cancer was genetic. It was not, I knew it was, but I just didn't want to hear that. And it was hard to tell my family. And they didn't really necessarily all agree with me right away, and maybe a little bit of pushing to get the genetic testing done, especially my brother. Men are very difficult. But they did the testing, and sure enough, my sister has the variant, and both of my daughters. And Dr. Davis and Dr. Perry Guilford both agreed that, unfortunately, yes, it was pathogenic, and given our family history, it was quite serious. So my prior to that, we went to, I did the right thing. I took my daughters to genetic counseling, right? This is the thing to do. Yeah. And so my 18-year-old, she's 20 now, had a little tear in her eye, and the genetic counselor said, you shouldn't get the testing because this is upsetting to you. And if you test positive, they might suggest a gastrectomy. And can you imagine the anger that I had? I mean, who are you to say this? Who are you to make this decision about my children? And it took me a long time. I'm still not quite over it. But she didn't. My older daughter was like, "Give me the test. Are you kidding me? I want the test." My mother died at 33. We need this information. Um, so anyway, my older daughter got the test first, and she did test positive for the variant. And then I think my sister came next, and she did test positive. Then finally, my younger daughter, I said, Claire, you have to get the test. It's just the test. Well, Dr. Davis is not going to take out your stomach the next day. She finally did get the test, and she was positive. So then come the endoscopies. And so, of course, my older daughter was already enrolled in the trial, and she got the endoscopy. And sure enough, signet ring cells. And I just couldn't believe it. 22 years old, signet ring cells. Um, and again, I know it's a blessing, but it doesn't feel like it right now. It's not fun to watch your 22-year-old starve and have to learn how to eat again. And then my sister had her endoscopy. She didn't have any cancer cells that they found. And then my 20-year-old, they did the endoscopy, and sure enough, cancer cells, signet ring cells in her. And call it what, maybe it's precancer, maybe it's not. In my book, it's a cancer cell. It's not intestinal metaplasia. It's a signet ring cell, and it needs to be taken out of the stomach. I don't have any signet ring cells in my stomach right now. I have obviously in my bones, but it has to come out. And Dr. Davis does agree, given our family history and finding signet ring cells at such a young age. So my sister had her gastrectomy. We're very lucky we're here. We can go to NIH very easily. And because it's CTNNA1, something different that they haven't seen, I think it benefits them, to have us in their study. So that's my daughter getting her total gastrectomy. My sister had hers in February, and my younger daughter will have hers this summer. She wants to have a year away at school, and I think it's a good idea for her to grow up a little bit before she has her surgery. So the next is a little more pleasant, if I can get to it. Okay. So I know we've talked a lot about nutrition and alternative versus integrative therapies, seeing other doctors and support groups. So I just wanted to share this app. It's from Memorial Sloan Kettering Cancer Center. And I haven't seen anything else really like this. So I know for me personally, when the doctors say to me, "We don't have a cure for you," we might be able to help you live a little longer. We might be able to take a little bit of your pain away, but we can't cure you. Then I'm not going to go, "Oh, okay." Then I'll just do what you say and nothing else. Of course not. I'm going to do other things. I mean, I have no choice. So, I get acupuncture twice a week. It helps me a lot. It makes me a lot stronger for treatments. It's very important to me. I think it should be. It's a part of my cancer center, and I wish it was a part of everybody's cancer center. They also offer massage, which helps a lot with my pain. I have a lot of bone metastasis. It helps a lot with nauseousness. If I can not take as many pain pills, I think it's a very healthy thing for my liver. I have a really great relationship with my primary care doctor. I see her every 2 months, and we talk a lot about the side effects from my chemo. We talk about my nutrition. We talk about, she draws my labs. I have inflammatory arthritis from the Opdivo and the Keytruda, and she spends a lot of time with me, and she's very helpful. And that helps a lot because when I go to see my oncologist, I don't have to talk to him about all of that. I want to talk to my oncologist about my biomarkers, my treatment, my scans. These are the things I want to discuss with my oncologist, and it helps me to go to other doctors the rheumatologist, my primary care doctor. If I get a rash, I go to the dermatologist. They're all there for me, and I think it's been very helpful to me to have a big team. And when I'm with my oncologist, we're focusing on getting rid of this cancer. Um, and then last is where I am now. Unfortunately, I did have a recurrence. And anyway, it just says recurrence on the next slide. I don't know if it's going to, but it's a cute picture of my daughter. So there we go. So that's my daughter. She just got married, and her husband watches every bite that goes into her mouth. So that I don't have to worry about that anymore. That's my older daughter, who will have her gastrectomy next summer. I've been told all along that my disease is not measurable because I have it just in my bones and, of course, my stomach. But it was just no trial for you, no trial for you, no surgery for you. You don't, that none of those things are on the table for you. You have what your oncologist can give you, and that is all. Um, I'm not going to give up. I keep on trying. I think someday, maybe if I can get the cancer under control in my bones, I will start asking surgeons again for the total gastrectomy. I don't think it's a good idea now because my bones need my stomach. But also a clinical trial opened up. My doctor at NIH and my doctor at Hopkins said trials are now opening up for non-measurable disease. And I had a scan on a Wednesday, and that afternoon when I got home from the scan, Hopkins called me up and said, we got approval today to take patients with non-measurable disease. And it was just in time because my cancer was just, it went from kind of under control with radiation here and there to just really everywhere throughout my hips. From my skull, I have cancer all the way down my neck and my entire spine. It's in my shoulders, my sternum, it's just all the way down to my knees and probably further, but that's where they stopped the scan. So I did get into a clinical trial, and I'm very, very grateful for that. I feel it was divine intervention. And I'm on round 3 of that. So it is, I think that the TOR study probably kind of played into that because it's olaparib, which is normally used, for genetic cancers. And my local doctor feels that, my cancer is genetic. Who knows? Maybe there's some synergy there. So olaparib, which is tough. I'm really tired on that drug. But it's a pill, PARP inhibitor. So I like the idea of that. I have my Keytruda, which is my immunotherapy, which the Opdivo has kept the cancer out of my torso. So I don't want to give up something that's controlling what's in my torso for something that might work better in my bones. So I've got the chemo, which tends to work better for the bones. I've got my immunotherapy, which has, for almost 3 years, kept cancer out of my stomach. I've had 4 endoscopies. There's no cancer in my stomach. And then when the cancer is kind of ugly enough to beat both of those, then I've got the PARP inhibitor, which prevents the cancer from repairing itself. So I like the combination. I believe, I believe that if my mind understands how it's working, it's like the placebo effect, but then kind of flash forward. Okay, I'm getting these treatments. I understand in concept how they work. And as I get them, I meditate on that. Like I want my body to take it in and make them work. So that's where I am now. I'm in a clinical trial for my progression, and I feel good about it. I don't know if it's working yet, but that's it. That's my story.